Split. Okay. I hope this works. I'm going to be talking about the role of a radiology technologist or technician in healthcare today. They perform diagnostic imaging, they work with patients, they may work different specialties like X ray, CT, MRI, and they usually combine patient care with anatomy and technology. They prepare and correctly identify patients, they follow examination rules, they position patients and operate equipment as well as position the equipment that they're using. They maintain patient records, communicate with patients and staff. The medical terminology that's used typically is anything related to the body, so anterior, posterior, which is front and back, medial, lateral, which is toward and away from the body's midline, so like the middle. Um, Superior and anterior, which is superior is towards the head and interior is towards the feet, or inferior. I'm sorry, inferior is toward the feet. Proximal and distal. Proximal is closer to, and distal is farther away from like point of attachment. So this is like point of attachment. That's distal. This is proximal. Cervical, thoracic, and lumbar. So that's pertaining to lumbar is the back region. Thoracic's more like the thoracic cavity, so that's like chest area, and then cervical is more like the spine, so neck area. Usually they do radiography, which is like X-rays, CT, and MRI, which is magnetic resonance imaging, and they also do contrast media as well. They also are have to be safe as well, so they will like use equipment to help safety, which is like I know like when I took an X-ray, they have like a vest you have to wear, and then you also have to position the patient right. You have to make sure you're not exposed to too much radiation, um, and they also have a have to be able to take good images for doctors. The images that they might take typically have to be fractured images. So like anything, if you fracture anything, dislocations, chest, so like heart in the lungs, if there's like fluid buildup or anything in there. So or pneumonia as well, internal bleeding too. Sorry. And then typically for education, you have to have, of course, you have to have a diploma, and then you gotta have associates of science, and then you get into the program as well. Most of the states require license and certifications. You also get different certifications for different, I think it's modualities. So like CT, MRI, those are different certifications underneath the underneath the radiography scope. So it's like a tree and it branches out. They support uh, diagnoses through imaging. Um, they also have to know medical terminology to understand doctors and communicate with other staff as well. Those are my references. But I am done. I don't know how to end this.